Hey, I'm Joseph Delaney. I'm a pediatrician at SouthernMED Pediatrics, the Lake Murray location. So a concussion is the diagnosis used to describe the changes that happen, the functional changes that happen in a brain after some type of traumatic brain injury. Usually it's the result of acceleration, deceleration forces, or rotational forces that will cause some degree of impairment within the brain. Yeah, so the most common thing we'll see are sports-related concussions. So obviously you can get a concussion from other things like falls off of a ladder or fall off of a chair or a car accident, some type of traumatic experience like that. But the most common thing we'll see in our office is a sports-related concussion, with football probably being the most common sport to lead to concussion. Yeah, so typically there's, as a parent, you'll know because there'll be preceding trauma that you're either witnessed firsthand or you've heard about. So you'll have that preceding trauma in conjunction with symptoms like headache, nausea, vomiting occasionally, fatigue, some degree of mental confusion. Occasionally, in a small percentage of kids, there'll be a period of loss of consciousness right after the injury. Those are the typical presenting signs that we'll see with our patients with concussion. Yeah, so the main treatment is rest. You can obviously take over-the-counter meds like Tylenol or ibuprofen for the pain associated with a concussion, but the biggest thing we look for is just a period of rest, both physically and cognitively, having that period of rest to recover. So in the peds population, they tend to last or have the tendency to last a little longer than with adults. So you're looking at anywhere from about 7 to 10 to 14 days with symptoms. Return to play after concussion is a heavily studied area. It can be a little bit difficult to put an exact number on. There's some guidelines that will talk about return to play. The child needs to be completely asymptomatic for a given period of time that your provider can help you talk through. But then when they're asymptomatic for that period of time, they'll have to go through a slow process back to return to play that involves some slow aerobic activity, then building back towards sport-specific activity, and then fully back to return to play once that provider has felt like you have done those activities along the way without symptoms. Yes, I think not a bad idea to ever have that child evaluated, whether it's an urgent care or an ER or a sideline team physician. We see them commonly in our office the day of or the day after, depending on how sick the child is. Obviously, there's some warning signs that would make you seek that care sooner. So continued vomiting, pain so bad that the child just can't get comfortable or can't rest, ongoing confusion, or focal neurologic signs. Those things would prompt you to need to be seen sooner.